welcome to the MAPS monthly webinar series, Healing Tomorrow's Future. We are thrilled to bring you this new series packed with valuable information and education for our community. My name is Honey Renasella, and I am the Executive Director of MAPS, the Medical Academy of Pediatrics and Special Needs. With these webinars, we're aiming to empower our clinicians with the knowledge and tools needed to support patients that find a variety of health challenges. For more information about MAPS or to register for our conference, please visit us at www.medmaps.org, medmaps.org. Thanks for joining us on this journey towards a brighter, healthier future. Excited to bring alongside Cindy Schneider, who's going to be talking about maternal fetal immunology. Cindy's going to talk about preconception issues, as well as pregnancy issues, and so much more. I know that you have been around for a very long time, like myself. I feel like we all go way back. So if you could just tell our audience just a little bit about yourself and how you got into this.
I originally was a board certified obstetrician and gynecologist, and I absolutely loved that field of medicine. I think it's the most joyous field of medicine. In the early 90s, I had 3 children, 2 developed autism. So that really redirected my focus. And when my children were diagnosed, there really were no services. We had Bernie Rimland, thank goodness, and the Autism Research Institute. And if it hadn't been for him, I don't know what I would have done. My kids would not be where they are today, that's for sure. Luckily, I got connected with Bernie Rimland early on, and he was very gracious about allowing me to go to think tanks and talk to other physicians and researchers with a lot of experience in this field. And he was instrumental. I know the younger parents don't know this, but he was very, very instrumental in bringing together great minds from all around the world, both in academia, bench research, and the battlegrounds in the clinical practice. And we learned from each other, and it was just such an incredible opportunity for me. And because of Bernie, I was able to do a lot of good things for my children. And eventually, after looking around and participating in some of the research that was out there, which at the time was only genetic, that's absolutely all the research there was. We got nothing out of it, absolutely nothing out of it. I also was pretty upset about the way the research was being done because, they drew blood from my children and in some cases from us as well. They took days out of our lives basically to participate in this research. We got no feedback, no results, nothing. And I thought, well, that just isn't right. And to this day, I have no idea what they found in the tests that were done on my children. And I don't think anything meaningful ever came from that research. And they were well intended. I'm not saying that they weren't. It's just that they were, I think, focusing in the wrong areas. And I decided to start a nonprofit organization for autism research, which is so for a while I was both an OBGYN and a researcher. And then eventually in 98, I quit OBGYN and I did the research full time. And we found some amazing things, a little bit every year, basically. It was a kind of slow progress, but it was moving the right direction. But we couldn't get any of the local pediatricians to order the tests or get behind the families who wanted to do certain therapies and or interventions. And so that's when I started a clinical practice. And so I was the medical director of the Center for Autism Research and Education for 21 years, and I just joined the Rosnell Medical Center last year. And so I'm in Phoenix and I have a clinical practice, occasionally do research, but my focus has always been trying to help the children who are diagnosed, but also in so many cases, parents come and they have a baby or mom is pregnant. Their child was just diagnosed and they would love to have more children. And they want to know, well, what are my risks? Is there anything I can do to prevent or reduce the chances of this happening in another child? And of course, at this stage, a lot of us have been in the game for more than 2 decades. So now we see some of our recovered kids, they want to have their own baby.
Right? Yes.
They're starting families or they would like to, and they're a little bit scared. And of course, at the same time, we all have all these siblings who are also of the age where they're starting their families or would love to start a family, but they're terrified. And so I feel like with my background, what I would like to focus on in the latter part of my career is prevention and just helping these families to mitigate the risks as much as we can. And of course, I absolutely love seeing the kids on the spectrum, and many have grown up in my practice at this point, so I have a lot of adult patients. But I also love working with women who would like to have a baby or who are already pregnant, just to see, okay, what could we do to make sure you have the healthiest pregnancy you can have?
I love that we're kind of kicking off our entire series on this because this is kind of where it all starts, right? So if
Yeah.
I could go back, right? My
Oh,
twins are
oh,
24 and they were born in 2000, and if I could go back and just change like three or four things,
oh
I
boy.
know that the outcome would have been completely different. So
I,
your work is so critical right now with all this awareness that we can change
mhm.
things, right? And that health of a mother, especially while pregnant, even before getting pregnant is important
That's
as
ideal. Yes.
I'm just so happy that you're who we're speaking with today. So
Oh, thank you.
tell us just a little bit about the maternal health and fetal development. Like, okay, so the maternal immune activation, like how is infection triggering environmental toxic, like influence and like fetal development? How important is it? Right. Because nobody ever mentioned any of this to me. When I was pregnant, it was like, take
Nope.
your prenatals and then live your life. So, I mean, this is completely, um, it's common sense now that I've known what I've learned from like all of your work for the last 20 years, but it's nothing that was ever mentioned to me. So if you will, just kind of explain that to people that may have never even heard this.
I think it's an underappreciated area of medicine. I know when I was in my training, there wasn't a word mentioned about it. The only thing I was ever told is that for unknown reasons, if a mother developed flu in the second trimester, she was more likely to have a child who later in life developed schizophrenia. So we knew there was some weird connection between a viral infection and this so-called mental illness later in life. Well, now we know it isn't just schizophrenia. It's autism, it's ADD, it's anxiety disorders, it's oppositional defiant disorder, conduct disorders, all sorts of things. And what we're learning now, which we certainly didn't know when I was in training, is it almost doesn't matter what disease of the brain you're looking at, whether it's Alzheimer's, autism, anxiety, it's inflammation in the brain. And it may be different areas of the brain, different levels of inflammation, different causes of the inflammation, but we're dealing in most cases with inflammation. So this neuroinflammatory response is something you want to prevent almost at all costs, really. And that wasn't appreciated at all. I was told so very little in my training. I was told Tylenol is safe. I personally don't believe it is. I
Mhm.
was told it's totally fine to get mercury fillings placed during pregnancy. I would never recommend that. Thankfully, that's not the norm anymore, but it certainly was
Mhm.
at the time of my training and when my children were born. And so what we have learned over the years hasn't disseminated out. I mean, so many of us in the autism community know these things that I think this year there'll be a lot of wonderful changes in public health. I'm very optimistic about that. But a lot of us have been trying to tell other people certain things about, toxins we think we should avoid and lifestyle changes that can make a big impact on your health and your family's health. And we've been sort of met with a brick wall because the most primary care physicians are disagreeing with us. But I think that, we have to have this very broad conversation about what are we doing wrong. And I think that conversation is just about to begin in this country because we have to look at everything from what are we telling pregnant women they should and shouldn't eat. All we say is don't eat high mercury fish. I mean,
Right.
that's about it. But what
Right.
about all the microplastics uh, and the phthalates and the heavy metals and so many other things? So I think in a perfect world, we would just try to educate the entire population about, well, maybe we shouldn't have food dyes in our food, and maybe, our school lunches shouldn't be full of processed foods, and carbohydrates and people need to understand what a pro-inflammatory diet is. Now our kids who are already sick have to go to the nth degree to reduce that inflammation. But even any step toward that for somebody who is just wanting to stay healthy or get healthy before conception would be like a low carbohydrate, nutrient dense diet. I think people really need to look at family history too. because if you have a family history of an autoimmune disease or asthma or allergies, you're already a high risk family.
Mhm.
I don't think people realize that, but most of the children with autism have a family member who has an autoimmune disease or something else like asthma, severe allergies, things like that.
You know what's so crazy is that so many people have always said, "Oh, do you have anybody in the spectrum in your family?" And I'm not, no, because if you've met me, you know that I'm probably one of the most social humans in the world, and my husband is as well. But the thing that's crazy is that what you just said is critical, right? It's
It
the
is.
autoimmunity that we're not
Mhm.
looking at, and that right there should be a huge component of like the history intake.
Absolutely. And I think even when I see histories taken from other people in our field, I think, wow, they didn't ask a lot of questions. Oftentimes it's like, I think it's really important to get a really do a deep dive into family history and see, okay, what honestly, what genes could be running in the family because they're not autism genes, they're immune system inflammatory genes. Is your immune system prone to being confused and angry?
Yeah.
And that could manifest differently in different people. So in one person, it could be early onset heart disease, and another person, it could be an autoimmune condition, and somebody else, it could be ADD or depression. I've seen so many parents of the kids with autism come in with some of these other issues, and they're just like their kids in terms of the underlying cause. Of course, their brain developed normally, but and they develop certain symptoms later in life, but the treatment is actually the same. So I do a deep dive into, well, where was the person born? Were they ever exposed to any toxins? Do they have any hobbies that might expose them to toxins? What's their occupation? Where do they live? Are they by a busy highway or a factory? Or a Superfund site? There's so many things. And I tell people, even my kids who are recovered and trying to figure out, their career path and where they're going to live and all that. I said, you have to choose a career that does not expose you to toxins. And please choose a career that allows you to have a normal sleep pattern. You don't want to be
Wow.
sleep deprived. You don't want to be working the night shift. You don't want to live in a polluted city. Those are big variables. And can you stay healthy? Because I feel like even our recovered kids have a fragile recovery. They have to take good care of themselves. I always tell them you're like a Ferrari, not a Volkswagen. You have to really take good care of yourself.
Need that high octane fuel.
Exactly, exactly.
AKA
Yeah,
organic, gluten-free, dairy-free food to keep yourself straight.
exactly.
Like, we call it managed recovery almost, right?
Okay, that's fair.
For
That's
my
fair.
friends, because I've seen a lot of them slip backwards when they do
Sure.
go into that type of an environment, which is crazy because sleep was not really on my radar. But it's interesting that that's when your body heals, is when you sleep.
Yes, you detox and you recover. And you probably already know sleep deprivation is another stress that increases inflammation.
Yep.
So if you're already trying to deal with inflammation and keep it at bay, you don't want to add a variable that's, kind of beyond your control like that. Like, so because we know people who work the night shift don't live as long and they have more heart attacks and car accidents and things like that. Well, also they're just dealing with so much inflammation. So the hard thing too is that these kids, as they get older, they have to take more and more responsibility for their own diet and supplements and personal decisions. And every everybody has to learn the hard way, I think. Sometimes they can fall pretty hard before they do learn, unfortunately. But back to your question, I think the ideal situation would be to work with somebody even a year before they want to get pregnant, because the same tests we do for the children on the spectrum would be incredible for every person to have. I mean, the only reason we're not doing it is because insurance doesn't pay for most of it. But you can do some basic labs through your local lab and some specialty labs to look for heavy metals and fatty acid levels and toxins, all kinds of things like that. Our ability to look for things we couldn't see before it's growing every year. As you know, a lot of the kids also make antibodies against their folate receptors or
Mhm.
their myelin or things like that. Well, I'm starting to test some parents for that, and it's pretty alarming that a lot of them are making the same kind of antibodies that shouldn't be made against their own, in some cases, their own nervous system.
Wow.
So, and if you find that, and they may be asymptomatic or minimally symptomatic, they may just think, oh, I have ADD, no big deal. But I think that we can deal with these. Keep in mind that most of the people who get pregnant are very, very young. So if they're prone to have a certain condition, it may be in the earliest stages. Maybe a woman is developing rheumatoid arthritis or psoriatic arthritis or lupus or MS or something, and she doesn't know it yet because her symptoms aren't that bad. But if we can do these kind of screens and look for inflammation like a C-reactive protein or a sedimentation rate, there's just some simple tests that you can do at any lab just to see, is there some inflammation that we didn't even know was there?
Mhm.
Because I know from experience that when you have inflammation, you just adjust, you just adapt, and it just becomes your normal. You don't know how bad you were until you feel better in some cases. So I know I have psoriatic arthritis and I had the early stages of the disease when I was pregnant. I just didn't know that. I hadn't been diagnosed because it hadn't, gotten to a high level. But if I had known then, as you were saying before, if I'd just known then what I know now, my kids would have had a much easier life, that's for sure. So we have to look at things like, vitamins, minerals, heavy metals, fatty acids, inflammatory markers, and then just really have an honest dialogue about, well, what do you eat? What's your lifestyle? And
Mhm.
obviously, we don't want smoking or exposure to recreational drugs. That's things like that are obvious, but in today's world, a lot of people are vaping or doing a lot of other things that they think are no big deal, but I think they are a big deal if you want to have a healthy baby. What we're finding is that some of these inflammatory markers open up the blood-brain barrier and they make it even easier for toxins to get into the brain where they don't belong. And so all this is just critically important. And simple things like a vitamin D level. I mean, vitamin D, everybody learned during COVID that it helps your immune system fight off infection, but it does even more than that. It reduces inflammation. It lowers abnormal immune responses like allergies and autoimmune reactions, and it raises dopamine activity in the brain. So there are a lot of reasons why I have to tell people almost every day I don't agree with the lab norms. There's one lab that we use that claims that a vitamin D level is optimal at something like 30, and I'm thinking, well, I don't agree with that at all. So we have to look at our norms and have a really serious discussion about lab norms too, because in integrative medicine, we always talk about optimal range, not just normal range. So normal is where 95% of the people fall. I want to be where the healthy people fall,
Right. Wow. They
just
should
the
have
healthy ones.
categories.
Yes, yeah.
Absolutely. So would I. I'd want my range to be with the healthiest.
Right. So it's like, like people can go to somebody for concierge medicine and things like that, or a professional executive physical and things like that and gets these tests. But I think we all need these tests. We really do, just to head off disease before it really gets out of control, before it may even manifest as an obvious disease, things like diabetes. So we all know there's this huge epidemic of obesity. Well, that drives inflammation. Most of America now is overweight or obese, and I don't think that the Ozempics of the world are going to solve that. I think lifestyle changes are going to solve that. We have temptations everywhere. I think about my grandparents and what they lived through and how many changes they saw in their lifetime. And, everything they ate was organic.
Mhm.
They didn't have to pay twice as much for organic food. Everything was organic, but they also had to work hard for it. They made their own bread. They
Mhm.
shopped for their groceries every day or two because they needed it to be fresh and they didn't have the freezers and refrigerators like we have. So, and they ate food in season, which was when it was at its peak and it was local. So, without even knowing it, they were doing all the right things. And it's so easy for us to accidentally do the wrong things now. So, I like to talk to people about dietary choices and just dealing with stress too, because I feel like we live in a very fast-paced, stressful world. A lot of us are expected to put in long hours. And after a certain point, your body rejects that, rebels. Some people can take it for years and years on end and still thrive, and some people can't.
I love that you just mentioned stress because I tell people all the time, stress is a toxin. Like
Yes.
it's a toxin. And this is something that nobody really talks about because nobody comes and
No.
shares their stress level. They look at the labs, but
Yeah.
it's critical to your point.
I have some patients in my practice who are, they have very, very high IQs. They're very intelligent, very capable. They could major in anything they wanted to in college. And I just sometimes tell them, is that the career path you want?
Mhm.
I mean, are those the hours that you want? Try it for sure. I don't want to burst their bubble. But I've had some who changed career paths because yes, they love a certain subject, but a slower paced, less stressful job is more tolerable. They can do 8 hours in some jobs, but not 8 hours in another job a day. So, I mean, there's so many things to consider, but in terms of like getting healthy before pregnancy, basic labs are like the beginning and looking at changes that need to be made because the fact is if we do find a high level of toxins, we're not going to be able to get those out overnight. It takes time. And you don't want to get pregnant during detox. You want to get pregnant after detox. And of course, if a person's already pregnant, we're not going to do any aggressive detox. We're just going to, you know, call a ceasefire, try to prevent as many new toxins from coming in as possible. And some of the simplest things like just hydration. I look at some people who don't drink enough fluid. Well, we have to be hydrated to dilute the toxins and, and excrete the toxins and just being kind to your liver because, of course, people who are the age of having kids are also the age where there's a lot of alcohol intake.
Mhm.
And you just want to make sure you keep your liver healthy and you detox as much as you can. And we forget about the dads sometimes. I do focus on the moms mostly because um, they're going to be the ones gestating, but the dads are important too. And we know for one thing, the sperm counts are plummeting around the world, and that's because of the toxins, most likely. We want to make sure that the dads are healthy as well, so that the chromosomes that they donate are healthy ones too. I think the assumption when I was in training was only the healthy sperm are going to fertilize the egg. Well, generally that is true because a lot of the unhealthy sperm have poor motility and all that. But now people go to IVF and they overcome that. Um, and maybe it's not the healthiest sperm that fertilized the egg. Or maybe the mom wasn't, I'm sure that the reproductive endocrinologists are measuring inflammatory markers these days, but are they doing everything they can to reduce the inflammation? So are they looking at methylation? The same exact things we have to look at in our kids, we should look at in ourselves because one reason for inflammation is not being able to make enough glutathione. And one reason for that is not having good methylation. So that means, do you get enough B12? Do you get enough folate? Do you get them in the methylated forms that your body can use? Or are you taking the wrong supplements, eating the wrong food that's fortified with the wrong things and unknowingly making yourself sick? So that's a big part of the puzzle too, is so many people, including parents, if they just start the same supplements and B12 injections and diet that their kids are on, they suddenly feel better.
Mhm.
ADD, depression, anxiety, all kinds of things get better. Even, gut issues and all that, because that certainly runs in the families as well. So I think these are more universal things. I mean, I can focus on pregnancy, but I feel like these are recommendations that everybody would be better off if they followed.
It's basically just saying that we all should get this healthy, right? And follow
It would
this.
be ideal.
And it's so hard to listen to this too, because like I said, I'd love to go back 20 years because I could tell you, like, I could not use any of the folate in my prenatals. And
Oh, me neither. I
uh,
didn't know. I
and
was a good girl and I took it every day.
no, it's just so awful. And I'm like, could we just switch that to a methylated version that like we all could utilize?
It would
But
be so simple, but
right,
it hasn't been done.
it will be. I have a
I
feeling
think
we're gonna
this
get
is the year.
here. We're gonna get there. We're gonna get there. But the other thing is too, I mean, like even listening, these are such great points. And because our audience is always like the healthcare practitioners and the physicians. And
Oh,
even just knowing, some of this critical insight, like make sure you sleep, try and clean up, your environment, try and clean up your diet, like watch your prenatals, make sure you can methylate what you're intaking.
mhm.
I had a mercury filling while I was pregnant. Like, I mean, there's just so
And
many,
they thought
like,
nothing of it. Absolutely. I was told in my training, no big deal.
Mhm.
And they didn't even take the precautions we would take today.
My doctor that was treating my kids, my MAPS doctor was like, "Ooh, this was bad and this was bad." I'm like I would run. And the tragedy is why this is so important that you get this information out, though, Cindy, is because I would have done anything,
Oh,
an-
yeah.
anything that you would have told me to do that would have helped my child have the best chance of success in life. I would have done like by the book. Like I had low fluid on my one son. I had twins and I had low fluid on baby A, and they were like, "Oh, you need to take a bath an hour a day." The perinatologist was like, "To increase your fluid." And I was like, "Okay, hour a day." I did too. Like
You did too. Yeah. You're an overachiever.
our maternal instinct is to do what we can to help our child. And if we're growing a child inside of us, we're going to
Hmm.
take all of this information and truly utilize it to help the outcome, right?
That's
So
the biggest responsibility you'll ever have. Yeah.
I
Yeah.
just heard Dr. Fry, I actually have it written right here. Pregnancy is the most influential environment a child will ever live in.
This is true.
He literally just said that. I wrote it down because I said, why do we not know that? So this is why I thought that was fascinating, because I never heard anybody explain it that way. But it's true, right? So if we can clean up the environment before we get pregnant, if somebody gets pregnant, not knowing any of this prior, then the goal would be to be as healthy as you can possible, cleanest possible diet. How critical is breastfeeding?
It's enormously important because breast milk, of course, has so many more nutrients in it than formula will ever have. The right fats, and assuming the mom is eating a healthy diet and everything. But it also has IgA, which is an antibody that helps protect the baby against infections. And there's almost never a reason not to breastfeed. You know, maybe if a mom has to go through chemotherapy or take some terrible medication, okay, fine, then that person can't breastfeed. But I remember back when I was still delivering babies, I would have the moms talked into breastfeeding, but then the labor and delivery would give them free formula. Or the mom would be sleeping and they say, "Oh, we'll just give this baby a little formula, let mommy sleep." Well, it comes out of a bottle really quickly. You don't have to struggle like you do with, breastfeeding. And it's full of sugar. I mean, corn syrup is the first ingredient in most formulas. So after that, then the baby doesn't want to breastfeed because it's more work and it's not as sweet. So we want to just warn parents ahead of time before you even go into labor and delivery. There's a time and a place. Sometimes you do have to supplement a baby, but if it's at all possible, you want to exclusively breastfeed. And then what came up over and over again when I was delivering babies is moms would say, "Well, I know I have to go back and work in 6 weeks. What's the point of breastfeeding?" And I would always say, even if you can only breastfeed for 6 weeks, please do that. And depending on where you work, you might be able to pump and store breast milk. Or make some special arrangements with your work schedule. And nowadays, more and more people are working from home, so that's maybe more doable for moms today than it ever was before. But it's incredibly critical to breastfeed if that's at all possible. And that's the other thing is I think it's important to do nutritional tests before, during, and after pregnancy because pregnancy takes a lot out of a woman. We know from famines that moms were emaciated, but their babies were almost normal weight. So the placenta is designed to take nutrients into the baby. And oftentimes that's at the mother's expense. So you want to make sure, even if you were perfectly healthy before, test periodically during the pregnancy and after delivery, because if you're breastfeeding, your nutritional demands are extremely high. And in your case with twins, I mean, off the charts. And women who breastfeed know they're hungrier than they were when they were pregnant because it takes so much to produce that nutrition for the baby. So that kind of testing is incredibly important. But we know it helps with the microbiome of the baby because if you're feeding your baby sugar water with vitamins, which is pretty much what I think formula is, and often the wrong vitamins, as you know, they're not going to have a healthy, normal microbiome. They're going to have a different microbiome. And we know a lot of the formula is fortified with iron. Well, that sounds like a good thing. And I thought it was way back in the day because we didn't want, a baby who's iron deficient, but iron's pro-inflammatory and it changes the microbiome. So even things we think of as good are good in moderation, or there's this sweet spot. You don't want to have too much, you don't want to have too little. And there's a lot of ignorance about that in the medical community. And of course, we wouldn't expect parents to know anything about it at all. It's sad that the physicians don't either. And just optimizing zinc and selenium and vitamin D and fatty acids like the omega-3s and looking for food allergies, food intolerances, because I mean, I'll never forget when first started doing the food intolerance testing, which a lot of allergists just, laugh at. They think it's ridiculous.
Right.
Um, as I said, I was for a while delivering babies and seeing kids with autism and doing research. And I had a mom in my practice who had severe postpartum depression. In fact, the dad called me and said he was afraid to go to work because he didn't want to leave her alone with the baby. He was terrified. And I happened to do some of these tests I was learning to do on the kids with autism on her, and she had a few food intolerances and she needed a few other things. Her depression just reversed almost overnight. It was eye-opening to me because I'd always been taught, well, you just prescribe Prozac. And they all said, oh, that's perfectly safe in pregnancy, and that's perfectly safe when you're breastfeeding. It's like, well, I try to avoid it and usually you can avoid those sort of things. But it was shocking to me how her depression was so bad. The dad thought, she's going to commit suicide, and he didn't know what would happen to the baby. Well, she just snapped right out of it. And
Oh,
so that made a believer out of me because that's how bad the inflammation caused by some of these food reactions can be. And you think of food, people laugh at us for putting our kids on gluten-free and dairy-free diets. Well, wouldn't you know, lower your sugar intake if you were diabetes, when you lower your uric acid intake if you had gout, and your cholesterol intake if you have heart disease, things like that. So I think that people need to be more serious about this kind of testing and simple changes, and tests that maybe we don't fully understand, but that they actually work.
I breastfed my twins for 16 months. I feel like it's the best gift I probably ever gave them. I can't even imagine how unhealthy they would be today if I didn't. I exclusively nursed them.
Wow.
And I actually thought
Very
those
impressive.
were too complicated. So I was like, God gave us those for a reason. So I'm going to just feed my children. But I do want to ask you one interesting question. I do feel like, though, a lot of my boys' issue, though, is because what you're saying is really critical. I had a child and I got pregnant when she was a year old. I nursed her for a year.
Oh,
So it probably depleted me of a lot. And I
I
got
bet.
twins. So
Yeah.
that
Can you
year
imagine?
probably took so much more out
The
of me.
well was empty.
Right. And so I just a little theory of mine, my twins have a cerebral deficiency. So it's
Hmm.
confirmed via spinal tap, muscle biopsy. They have mito dysfunction. So I know that I didn't probably have enough to pass, anything to them because my daughter probably just completely depleted me and my placenta was
Of
trying to fight
course.
me too. And so
True.
and then
True.
I nurse them thinking I'm doing the best, but I should have had, like what you're saying to your point, it's just crazy that
Every test.
I would
Yes.
have had, if
Yeah.
I would have had any of these, again, would have loved this knowledge to have tested myself to see what I needed to do. Because that's something that should be factored in, right? How close the pregnancies are,
Absolutely.
right? So I feel like
Absolutely.
nobody ever talks about that because I feel like my daughter she was great. And she's got some autoimmune issues and celiac and whatnot, but she's wonderful. And then my twins later were the ones that were diagnosed with autism, which we knew was from a toxic overload environmental stress. But I do feel like the back-to-back pregnancies is even more
Yes.
of a reason to get the parents checked. So like once they're breastfeeding,
Absolutely.
then if they're planning to have another baby, make sure it's really critical. Yes.
Absolutely. And that's always been a question on my questionnaire is how much time was there between the pregnancy of the child I'm seeing and any previous pregnancies, and how many miscarriages did a woman have? Because that's another thing that they brush off a lot. But I think that's very important because now we know if you have MTHFR mutations or inflammation, you're at higher risk of having a miscarriage. So that's a clue if that had happened. And of course, miscarriages are common even in the general population, but they're more common in our families. And
Mhm.
it probably has a lot to do with the methylation weaknesses and the toxins that we're exposed to.
I don't know if you know this about me, but I grew up in an organic goat farm in Vermont. And
Wow.
yeah. So I used to get really upset that my mom was such a hippie, but I have to tell you,
Oh,
I had my like I've never had a miscarriage. I feel blessed, but after like knowing some of this history, I feel like okay, my twins got the short end of the stick, but my daughter, I was like, praise God, like I grew up that way because probably had I done my labs, I would have been pretty healthy because
you started out healthy.
I was like 26 when I had her. So I'm like, I was pretty, healthy and robust. It's just like the second pregnancy, nursing, like the
Oh
raw
yeah.
milk, the filling, like a lot of, you
Oh
know,
yeah.
after. This is so incredible about how we can proactively prevent any of these issues, right? By checking the autoimmunity and everything that's going on within the parents and the history and the father and the mother prior, if we can, making the pregnancy the best that it absolutely can be the minute you catch it and you learn this knowledge. And then you did say about stress and sleep, and I do have to just ask you this because I don't even know if you feel comfortable answering this, and forgive me if you're not, but I actually did not circumcise my twins because one of my best friends had three children, all natural, Boston Birthing Center, never induced anything. But her first two children, she had them circumcised, and
Okay.
she was well enough after her second one to go in and watch it. And when she saw the amount of
She's
stress
horrified.
on the child, she was like, I don't care if my third is going to be a boy. It will never look like the first two because no child should have to go through that much stress. And I have to tell you, that's probably why I didn't. I mean, there's some other reasons. Like in Europe, they don't even do stuff like that. And my family's German, my husband's family's Italian. So they don't, it's not even a common practice over
Not a
there.
big deal. Yeah.
But right, it's not a big deal. But I will say that stress on that baby, the way that she explained it to me was so powerful that I was like, I would
You
never.
would not want to watch a video.
Oh my
No.
gosh, I don't ever want to see it. But but to your point, when you're talking about the amount of stress, right, that happens
Mhm.
on these kids at that young of an age, like that's got to factor into something, yes or
Well,
no?
you're right. I think about so many stresses that the babies go under. Just being born is a stress. You have to reroute your entire circulatory system. You suddenly have to regulate your own blood sugar and every other hormone and your body temperature. And your lungs have to give you the oxygen. You don't get it from mom. So birth is already an enormous stress. I think even if you choose to circumcise, that's not a great time to do it. If you do want to go that route, there's anesthesia, local anesthetics and things like that that you could choose to use. They don't do it most of the time. I mean, I'm not in the hospital setting anymore, and I don't know what's common today. But back when I was in the hospital setting, um, I was one of the few who used Emla cream prior to a circumcision. And even that wasn't total relief. And, it doesn't always work as well as it should. But I used to routinely do circumcisions because it's sometimes the pediatrician, sometimes the obstetrician. And it was heartbreaking, because it's not a pleasant procedure for that poor little baby. And the interesting thing about maternal immune activation and fetal immune response is that boys and girls are different. This
Mhm.
is the strangest thing. There are many more women with autoimmune diseases than men. And we all know there's more autism in boys than girls and more ADD and learning disabilities in general in boys than girls. Well, when we look at these lab models of maternal immune activation in animals, and we look at moms who've had their inflammatory chemicals measured throughout pregnancy, the response is different whether you have a male child or even lab animal versus female. And girls are tougher. We don't have, we don't we can take a bigger hit than a boy. And as you were saying, it's circumcision is surgery that's generally done without anesthesia. It really is. And I mean, I don't even know what that does to a baby psychologically, let alone from an immune standpoint. And then we hit them with a hepatitis B vaccine before they go out the door. Uh, and some of them were already jaundiced. Like I think about my kids, and 2 out of 3 were jaundiced. And
Same.
I still did everything right on schedule because I thought, well, you have to do that. But that was a really bad decision on my part because I didn't know better at the time.
I know
And
that's started off. Don't you wish you knew all this stuff 20 years ago when we were having our kids?
you got it. You got it. But at least we can teach others and help
So
prevent.
it is a trauma. It is an additional trauma. I mean, I know the birth in and of itself is like traumatic. So
Mhm,
it's so interesting
mhm.
that the boys are the ones that don't handle the trauma as well as
Well, it's strange. Even when you look at head injuries, traumatic brain injuries, um, men are going to have a worse outcome than women, or boys have a worse outcome than girls. So it's just fascinating. And then part of one of the lectures I give is the difference between the male and female brain. And there's shocking differences. Some areas bigger in males than females and vice versa. And we don't know how resilient these areas are. And some areas are just more um fragile. So if a toxin comes along, for example, your hippocampus is a very fragile area, and that's where you lay down your long-term memory. So of course we know in Alzheimer's that's an area of the brain that's affected. So but it's also an area that's often attacked by the immune system, even in our kids. So, and the cerebellum, things like that. But so there's a lot we have to understand, and there seems to be some estrogen seems to be protective in some ways. So there's hormonal issues, and that's another thing I forgot to mention is another thing that would be great is for women to have their hormone levels checked because you want to make sure everything's in balance because PCOS, polycystic ovarian syndrome, is very common in the moms of kids with autism. It may or may not lead to infertility. It certainly can, but it doesn't always. And so that's almost always associated with high testosterone, which is pro-inflammatory and probably somehow a risk factor. And it also leads to insulin resistance and in some cases high blood pressure. All these things are bad for fetal circulation and fetal immune development.
And so ideally, you'd want to get that done prior to getting pregnant,
That
correct?
would be fantastic.
But then
Yeah.
still utilize the information if you are pregnant and
Oh, it's never too late. Even if your baby's already born and we're just thinking, okay, well, because it happened to me, I just didn't know anything back then. My youngest was 7 months old when his brother and sister were diagnosed. And I immediately took him to see all the people we took our kids to, our older two, and they said, oh, he's just fine. Don't worry, you don't have anything to worry about. And I said, well, you don't understand. His brother and sister were just fine too at that age. And they thought I was crazy because they didn't believe that regression was possible, but it absolutely is. And I do think that there's just so many things that we could do, and even things like EMF exposure. That's a topic maybe I should touch on too. We're just drowning in EMF exposure. People have the Ring doorbells and the charging stations for their electronic vehicles and their Alexa and their Wi-Fi and everything. And that alone can make a person have ADD symptoms or depression or anxiety or sleep disorders. And if you already have those things, you don't want to layer more problems on top of an already fragile nervous system. So we live in a world where these things are really hard to avoid, but you could at least reduce your exposure. Things like, getting rid of your smart meter, which a lot of people in California wish they had done right now. But is the smart meters are emitting constantly. And if your child's bed is just on the other side of the wall from that, what are they exposed to all night long? There's just so many things to think about.
I'm one of those people that shuts my Wi-Fi off at night.
Good
So,
for you. Good
I
for you.
mean, I
Well,
have
and it's another small, it may seem like it's small, but to me it isn't. Like I tell people who live in an apartment, go see where the meters are. You don't want the apartment by the meters because imagine what those people are exposed to. And
Mhm.
they tend to put these, you know, um, cell towers by apartment buildings and schools, which I think is just terrible because you're exposing a lot of vulnerable people to those things. But
I remember that. There was one right next to my son's special needs school. I thought it was so
yeah, that's not right.
and I always have told people I'm pretty big on the environmental components, cleaning up my kids' environment and whatnot, knowing really
Sure.
quickly how sensitive they were at a very young age. But I
Yeah.
will say, I always tell people, you can't control the world, right? But you
No,
can absolutely control your house. You can
that's right. You start there.
in
Right.
and you can control. I remember once Dr. Eastman spoke at one of our conferences, and she had said when you have a baby shower, it should all be recycled gifts. And I remember being like, wow, that was brilliant. Like somebody's old hand-me-down
It's
crib.
already outgassed.
Like, because this is not the same world that we were born in, right?
No, no, no,
There are
no.
so many chemicals
No, I mean, well, of course, the Toys
and
R
the
Us is long gone now, but I remember walking into it and thinking, I cannot stand the smell of all the plastic. But that's what you bring into your home when you have a baby. You get all these presents in there. All these toys are plastic. And when my kids were born, all the teething toys were from China. We later found out they had lead and cadmium in them.
Oh my gosh.
And that was a big deal in the news way back in the 90s, but it's like too late. They were all exposed. And you just think about these parents who haven't had time or the inclination to do their research. I mean, they they often try to do the right thing, like you buy organic baby food. Well, okay, but it's in plastic.
Mhm.
They're putting it in plastic pouches, which are sometimes lined with aluminum, or you're going to be exposed to plastic products. And people say, oh, I drink filtered water. Oh, but they mean bottled water that they buy. So they're ingesting microplastics and phthalates and who knows what other chemicals all day long, when all they'd have to do is install a reverse osmosis system, or buy a portable one if you're renting, and refill your glass bottles.
Yeah,
Or for
absolutely.
the kids, stainless steel or something. But these little things, I mean,
They make a big difference though.
they really do. And your cleaning products and your shampoos and your makeup. I mean, so much lipstick has now been found to have lead and cadmium, and mascara often has mercury. And it's like we're finding so many things in people's blood now that it's in their blood because they put it on their skin. So we do forget about all that. A lot of people eat very healthy, but they're not thinking about what personal products they're using for shampoo and lotion and makeup and things like that.
Yep.
So there's a lot to learn, really.
Absolutely.
But
I was really educated pretty quick, and I feel like I was probably blessed because my kids had like really significant eczema and are
oh,
really reactive to any perfumes or dyes. And so I was like, no
you
dyes.
cut it all out. Yeah.
I got all organic, no
Mhm.
perfumed laundry detergent just to reduce the environmental
Sure.
load on them. And it was amazing how dramatic it was
Yeah.
in they were fine. They were
Oh,
fine once I removed that.
absolutely. And COVID was especially upsetting to me because people had sanitizers everywhere. And I was like, you don't understand. You're absorbing those chemicals into your skin. And I seem to be one of the few who thinks that's true, but I cringe when I see those things. They're just so toxic. And people were using them multiple times a day. And in a hospital setting, you're forced to. You don't have a choice.
Before you walk in a room.
I mean, I know so many people who wanted to go into medicine. They wanted to be a nurse or a doctor or something along those lines, and they can't because of what's happening in the hospital setting these days. But I hope that changes too. I really do, because a lot of good people didn't go into medicine or the military or so many other professions because of things that were required.
Yeah, when they metabolically know what they can and can't handle, it will
You got it.
shape
That's right.
where what direction you take. Absolutely. I couldn't agree with you more. This is such amazing information. So we talked about like the preconception, ideally before you even get pregnant, and then the critical component of staying healthy during the pregnancy, understanding your levels, what's going on, and then when your child's born, how critical it is to keep the EMFs, the plastics, the environment all as clean as possible. Again, can't control the world, but you can control their environment in your house. So the only last thing I'll close on, so a lot of our kids are given these multivitamins. Do you have any thoughts? Right. So that's like the last thing I think of when I think of like pregnancy. And you have this amazing mission of trying to get kids to be their best version of themselves in the healthiest way possible, right? And so that's why this is so critical before you get pregnant, during pregnancy, after pregnancy. So what about these multivitamins? Like I have to tell you, Flintstones were like candy friends when they were
Yes.
kids, and
So
I was
many things wrong. So many
so,
things wrong.
yeah. So can you touch base
Well,
on vitamins and supplementation for like babies, young kids, toddlers? Like touch base on this. This is really
right.
important.
So if a mom's able to breastfeed, and most are, then I focus on giving the mom the right vitamins and doing the testing on the mom, because I don't want to drop blood on a little teeny tiny baby. But when the baby's maybe assuming the baby's healthy, we don't need to, but after they're a year or two old, we can absolutely draw blood pretty easily on a child and make sure their levels are fine. But in the meantime, I just focus on the mom and just looking at, maybe you can delay the introduction of solid food, and maybe you can prolong breastfeeding longer than the average. And thinking, of course, when you introduce a food, I don't know what's common knowledge now, but you have to introduce the vegetables first, because otherwise they'll never want to eat them. If you give the fruit first, they're never going to go for a vegetable.
Right.
and that sort of thing. But just thinking about, well, what were the finger foods we gave our kids? Well, I gave mine Cheerios. You know, when you pack the diaper bag, you need a snack that's going to be non-perishable. That was my go-to because I thought, well, look at all these vitamins on the side of the cereal box. This must be great. And it's low sugar and all that. But I didn't realize, and I don't want to get you in trouble with companies, but I don't want food that's full of glyphosate. And I think folic acid is the wrong form of folate. And so I was unknowingly giving my kids something they should never have. And of course, it's loaded with gluten as well, which turned out to be not a good thing for them. But, with good intentions, that was a staple in my diaper bag. That was what we traveled with. And they're pure carbs, and no very little nutritional value. And um, and then what else do you give kids? Raisins, loaded with sugar, loaded with glyphosate, promotes yeast. Because with our kids on the spectrum, we're always battling the microbiome in the gut and trying to make their bowel healthier. Well, you actually, we accidentally gave them all the wrong things. I know I did, thinking, well, that's healthy. Look, it's full of vitamins and iron, and it's not candy. Well, it might as well have been candy because it really was high in fructose. So, I mean, so many things that are just what everybody does are not the healthy choices. Now there's way worse things than Cheerios to give kids, which um, but I think I made a lot of mistakes back then that I would never make today. And I'm very happy to try to talk to young parents about avoiding the pitfalls that I didn't know how to avoid.
I know it's interesting because with my daughter, I actually didn't feed. I was pretty healthy, but everything was like an organic Cheerio, but it still was like
Yeah.
Cheerio. And so I was pretty, I mean, I was pretty like healthy that way. But it's interesting because with my boys, again, they that kind of woke me up really quickly. Like they
Oh,
were like really quickly when they were diagnosed, they were like, 20 months old. And so
mm,
really quickly I learned how important food was. Like food is like medicine,
sure.
right? Or it can be poison. And so
Absolutely.
that was kind of my mindset right from the get-go with my boys. And I mean, by the grace of God, they now like they eat salmon's their like favorite food. They love broccoli. Like,
That's incredible.
yeah, well, it took a lot of work, but I mean, but
Sure.
also I just didn't buy the bad stuff,
No.
right? Once I learned, but we didn't know, like, right? I didn't know that an organic Cheerio was not
Nope.
necessarily the best thing for my kid, or that raisins, even if they were organic, were full of sugar. Like we didn't know any of it.
Mhm. We never thought like that. Never. I just thought, okay, it's a fruit. That's a good thing. You need your servings of fruits and vegetables.
Do you think now with the American diet and the way that food is right now, do you think kids need supplementation or a multivitamin, or do you think still like the
I
breastfeeding is obviously the most important? The mother stays healthy. We know she's solid, she's breastfeeding. But what about multivitamins for babies and infants,
Well,
toddlers?
I don't know if you know this, but I created one for brain health. It's called
I know that.
Aperture. Yeah, it's at apertureinternational.com. So I believe very strongly that most of us do need to take a multivitamin with the right form of folate and the right form of B12, lots of methylation support, lots of antioxidants,
Okay.
certain things that are good for your mitochondria, because neurons, well, the cells that need the most energy are brain cells and muscle cells. So they have the most mitochondria. So they benefit from anything that's going to give you mitochondrial support. So definitely in the high risk families, I think it's important to have the mom on supplements and at a fairly young age, like by the time you're introducing baby food, which I like to talk to moms about making their own, and I should say dads as well, about making their own baby food. It's not hard. And then you know what your child is eating, and you know it's fresh and all that. So you can easily put like a sprinkle of a probiotic on mom's nipple when she's breastfeeding. So you wouldn't give a child, a little infant, a whole probiotic, but just a little bit would be amazing and probably reduce their risk of things like eczema and asthma and gut issues.
Wow.
So it's certainly not going to hurt when the child's able to start to take some baby food, some solid food, then that's an easy time to start to sprinkle a little multivitamin in there. I feel like if mom has a healthy vitamin D level and her omega-3s are at a good place and things like that, and zinc and selenium, all those minerals, chances are her baby is going to be in pretty good shape for the first 6 months or so anyway. And after that, then it's a little iffy because it all depends. Is this child a picky eater? Does the child have any gut issues? You know, if your child is not getting sick and doesn't have gut issues, doesn't have skin issues, then you're probably doing pretty well with whatever you're doing and whatever diet they're eating. But it never hurts to give a little extra supplementation. Just a side note too, is if at all possible, I would not put a child in daycare
Mhm.
because one of the things we know is if they have frequent infections, frequent antibiotic use, you are destroying their microbiome and you're changing their entire immune development
Mm.
in a very negative way. So a lot of times it's not possible. I understand that, but maybe even in a case where, you know, maybe parents can share child caring responsibilities, have like a local in-home daycare, something like that would be way better than dropping your child off at a busy daycare where they're just going to get one cold after another and ear infection and you know one round of antibiotics after another because that just changes their immune development 100%. When my little sister was born, um my parents were told don't take her out in public for 2 months.
Mhm.
Um Now you see newborn babies getting on airplanes and going to Walmart and places like that. It's like you have to recognize that they're vulnerable, they're fragile, and maybe just protect them a little bit. It's not that hard. We kind of have lost that old wisdom that was just common sense, really.
It's interesting because my husband is Sicilian and his family is in Italy, and they all live to be like 100. But what's crazy is they really kind of don't have daycares, and,
Good.
and they don't have, but they don't have daycares, and they don't have like retirement communities.
They have grandmothers.
Right. And I'm like, I would never take care of my children, but I know we're not all that fortunate. But you look at it and
Sure.
it's not
Sure.
just what they eat. I actually think it's a lot of like the way in which they live, right? So
Yes.
that's a great point that you brought up because I loved that. Like I remember like because his family was very, very Italian and a little bit older than I am. And I remember being like, that is so admirable. Like they just don't have
Yes.
like his mom took care of all of her grandbabies. You know, I was blessed to be a stay-at-home mom, so I didn't have a grandma to help me.
That's so
Yeah,
beautiful.
but
Yeah.
it was something that was very important to me because it was
Sure.
more about the social interaction for the mom. But now that I look back on everything, I'm like, wow, there's a lot to this, right? So
There
your
really is.
environment when they're at such a fragile age.
Absolutely. And nobody's going to take better care of them than you or, you know, pay more attention to not just are they fed and is their diaper changed, but you know, are they stimulated intellectually and nurtured? And it doesn't
So,
happen in daycare all the time, that's for sure. There's so
there
many aspects to this. I
is.
mean, we only touch the surface, really.
Yeah, I used to be a specialty diet counselor for Whole Foods, and I would do lectures on eating the way God intended to a lot of schools to just teach kids
Wow,
the importance of health. And I used to always tell the parents, you get one chance to raise a baby,
that's
one
for
chance
sure.
to raise a body, one chance to raise a brain. Like you get one chance.
Mhm.
You know, education is power. So this is amazing
Mm.
information. I hope that a lot of our physicians will take this insight and utilize it for their practices. I mean, it's just wonderful. I love
Well,
it.
thank you for being open to this because, you know, a lot of people don't think it's important, but I think it's where we really need to focus.
Where it all starts. It's where
Hmm.
it all starts. If my prenatal was different, if somebody had done a workup on me after I just had a baby, like it's where it all starts. It's so critical. Well, I think you really truly can save our children in the future with this message and with your information. So keep speaking your truth. And I love that you have a vitamin that you created because I had no idea that was not like a plug.
Well, that's
Oh, that's
well, I'm glad I had a chance to talk about that. Thanks.
yeah,
Yeah,
it's
I'm
critical.
excited about it because you know, I had a cupboard full of vitamins and I'd be opening up capsule after capsule to try to get my kids to take these things. And
Yeah.
it was just awful. And so I just decided to make it simpler.
What an absolute
Yeah.
blessing to stumble upon that. I'm so glad you're part of the MAPS community. That was amazing. Thank you so much,
Thank
Cindy.
you. It was a
Cannot even
pleasure.
thank you enough for educating all of our community on how to raise healthier babies.
Thank you so much.